So this is the final stretch of our training. You've already developed a campaign of escalating tactics to move your legislator, and we're now just going to talk about how to implement your campaign. And we're going to do that by sort of going in depth with the case study that we've been talking about the campaign to move Representative Ed Markey in Massachusetts to get him on board H.R. 676. Now, in the single-payer school, we're going to give you all of the materials that were used during that campaign. So if you need a place to start, you can go to that to get templates for press releases, petition language, open letter language, whatever you need, all the materials that came out of that campaign. Now, a bit of background for our Ed Markey campaign. Like will be the case for a lot of you, we had previously tried to get Ed Markey on board H.R. 676 3 years before, and he had said no because he had a particular problem with one part of the bill. He claimed that he didn't have an issue with single-payer healthcare in principle. And in this case, it was difficult because we actually agreed with his criticism. So what we did was over those 3 years, we worked with Representative Conyers' office, and we actually got the bill fixed to address Rep. Markey's concerns. So this campaign, we were coming back and saying, all right, we've addressed your concerns, and now we really expect you to become a co-sponsor. So one takeaway here is that you are almost always going to get from legislators some form of pushback, reasons that they give for not wanting to sign on to the bill. And it's going to be your job to distinguish between whether they have a substantive reason that they're not signing on or whether they're just being evasive. So having addressed what we felt was the one substantive reason that Rep. Markey had for not signing on to the bill, we came back with a campaign plan to get him on board as a co-sponsor. And our campaign was pretty simple. It was 4 tactics, moving from a preparation tactic through 1 low leverage tactic and then escalating to 2 higher leverage tactics. Our preparation tactic was to draft an open letter to the legislator, providing some background to what we had already gone through with him and asking him to sign on as a co-sponsor of H.R. 676. We then collected signatures from folks, and we only collected a little over 50 signatures before we handed it into him. But among those 50 signatures were all of the organizations on our power map, union leaders, community organization leaders, the folks who would be known to the representative and who we felt had a measure of power and leverage in his district. So one takeaway here is to really stick to your power map that you built at the very beginning of the campaign. And each tactic that you use should either be showing the power and the leverage you have or should be actually using that power. So when we submitted the open letter to the representative's office, we actually asked for a meeting with his staff in the district office visit, which we got. And we turned out about 20 constituents to the meeting, and we made sure that the folks who were in that room reflected the organizations who were on our power map. So at the district office meeting, the rep staff told us that once again, he had a couple of detailed issues with the bill that were holding him back from becoming a co-sponsor. Now, we responded at this point that we had already gone through a process of trying to address any of the rep's substantive concerns with the bill. We had a whole good faith process where we actually changed the bill in response to his requests. And at this point, although we were happy to continue working with him on improving the bill, we really expected him to become a co-sponsor. So in this meeting, we actually told the rep staff that if he hadn't signed on to the bill as a co-sponsor by a certain date, that we would be organizing informational pickets outside of both of his district offices on a specific date. Now, immediately after this district office visit, we sent out a press release to the media announcing that a campaign was being launched in the district to try and win over Ed Markey to sign on to H.R. 676. We described the meeting we had had with his district staff and that we were going to be holding these informational pickets on a specific date and at a specific time. Now, one takeaway here is that legislative campaigns are much more effective than just using a single tactic in isolation, like showing up at a town hall meeting and pressuring the legislator with a bunch of people, specifically because of the promise of escalation to higher and higher levels of public pressure. But for that to work, you really have to publicly announce your campaign, the fact that you are going to be using escalating tactics. So you need to tell this to your legislator, and you definitely need to spread the word through social media and through the press. So the day before our informational pickets, we sent out another press release for the media to cover them. And the day of the pickets, we showed up with about a dozen people at each district office, and we armed them with large signs so that they could hold them up and be visible to car traffic, and lots of colorful leaflets. The leaflets were for handing out to pedestrians, but also we put them on the car windshield of every car in the block so that when staff walked outside of their office, all they would see was basically our public education campaign. The leaflets themselves asked constituents of Rep. Markey to call his office and to urge him to become a co-sponsor of H.R. 676. And they maintained a very polite tone. We were supportive of the legislator. We acknowledged all of the other important things he's done and his history of support for universal health care, but that we really needed him to become a co-sponsor and to champion single-payer health care. Before leaving our pickets, we made sure to stick our head into the district office, and we had a quick sort of impromptu discussion with the legislative staff there. We told them about our intentions as a next step of starting a canvassing campaign where we're actually going to do door knocking in the district, urging people again to call the legislator about H.R. 676. And this became a very tense meeting. The staff were really obviously not happy with us that we had escalated to public pressure tactics. They were starting to give us significant pushback that we shouldn't be using these tactics, that it wasn't appropriate, that we were hurting our own cause. And it's natural for this to happen at this stage. Now, one important takeaway, when you reach this stage where things get tense, maybe legislative staff start lecturing you, really giving you significant pushback, trying to get you to back down from your campaign. You don't want to develop an antagonistic relationship with the legislator's office, engaging in back and forth and sort of accusing one another. Stick with your campaign of escalating tactics and your strategy. But in your verbal communications, you have to remain polite. And my suggestion would be that when talking with the office, to just keep coming back to your own reasons for why you were running this campaign. That honestly, it's too important for you and for your family and for the folks in your district or your union or the members of your organization, that real lives are at stake and that this is so important to you that this is why you were carrying out this campaign. So what happened after our informational pickets and our very tense meeting with staff? The next day, the largest newspaper in the district, local newspaper, ran a front page article covering our pickets and also sort of an in-depth discussion of Medicare for All as a healthcare alternative. And almost immediately after that, we heard from Rep. Markey's office that he would be signing on as a co-sponsor of H.R. 676. So we sent out another press release announcing victory for our campaign and thanking Representative Markey for becoming a champion for single-payer health care. And our last takeaway from this is to make sure to do press work and social media work at every stage of your public pressure campaign. So that's the end of our training. I'm sure you still are left with lots of questions, and probably many of you have incredible experiences of your own that we could learn from. So I hope that you'll engage in the forums on the Single Payer School, which you can ask questions of other folks. We'll have a great community on there to help one another. And I hope that you'll share with us your experiences and what you've learned from trying to move your legislators.